Good day, and thank you for joining. I am Sherilyn Francis, and on behalf of Hybridge Solutions, we welcome you to today's webinar. Additionally, we invite you to connect with us via social media using hashtag HIT Solutions Center. Hybridge Solutions is one of the nation's trusted advisors to health professionals in the redesign of healthcare delivery through electronic health record technology and other interoperable systems. The goal of Hybrid Solution is to improve clinical outcomes and the quality of care across patient populations and services. HBS is located at the Morehouse School of Medicine National Center for Primary Care. I now present to you today's webinar entitled Resources for Coordinating Care for Patients with Chronic Diseases, presented by Ms. Phoebe Nelms and Ms. Selena Williams. In compliance with ACCME guidelines, the following presenters have no financial relationship or with the manufacturer of any commercial service discussed in this educational activity. The objectives for today's webinar are to review ways to optimize your electronic health record, establish opportunities to manage chronic diseases through telemedicine, remote monitoring, and health information exchanges, and to identify incentive programs to increase revenue within your organization. We will begin with a poll question as we are transitioning to Ms. Williams.
So what can the National Center for Primary Care do to support your practice during the COVID-19? It looks like 47% said webinar fact sheet on effective telemedicine billing practices. 38% will request to have webinar and navigating family and work pressure during COVID-19. We have 25% requested webinar toolkit to support navigation of practices reopening. 34% webinars on effectively managing roles of team members in primary care during COVID-19 pandemic, front office, medical assistants, RN, and clinicians in the billing department. We have 69% requested webinars on effective chronic disease management and preventive health care and primary care practicing during COVID-19. And 16% requested private social media group for support to navigate family and work pressures during COVID-19. Thank you guys so much for your opinion and your feedback, and we'll work on having something for you soon. I'm going to continue with the presentation. Thank you so much, Sherlon, for that introduction, and we'll go ahead into the presentation. So we're going to talk about how to optimize your present EHR system. So first, we will start by lowering the overload of information within your system. Complete clinical data accessed with additional clicks. We know one of the major points of EHR improvement is to give physicians complete clinical and health data at the point of care. But we often know that it can be overwhelming and hinder the caregiver's efficiency. So we want to make sure we usually cause more time for the physician or caregiver to sort through the data that's not relevant to the patient and provide the data that is relevant to the patient. So it's very important that we provide relevant information that would assist the provider during that visit. The next way is specialize the clinical workflow based on care setting, specialty, frequently used information. So it is important to focus on your workflows for meeting the specific needs of individual care setting, health systems, and hospitals. Focusing on the workflow will help users in navigating the EHR system more easily and allow the provider to access the relevant information in the patient's chart. Add health IT tools in the mix. So some of you may be familiar with mobile prescribing. Integration of IT-based health tools in the EHR system can help better the clinic process and care delivery. So example, some now, like with the Medicaid Promoted Interoperability Program, they have APIs. That's one of the IT tools that is being requested for within the EHR system. It'll allow patients to provide health records to new facilities without going through the receptionist and making unnecessary phone calls. Another thing is mobile prescribing. It has been very beneficial to a lot of providers. This platform is a great IT functionality that allows providers to access when they are visiting patients in the hospital, nursing facilities, or even when they're on the beach, they can access their phone and prescribe medications through their mobile. When integrating these tools, you will have to ensure that they require fewer logins and accessibility to providers on the move. So this is a efficient process doing care coordination to maintain care coordination. Provide ongoing training and feedback. Ask your staff how the process is going. Listen to their feedback and ideas. Provide training to ensure all expectations are being met. You ensure that you have the support of your EHR provider. It's possible you will miss out on the functions that may need modifications and parts that not need to be touched for present time. So it's very important that you bring your EHR vendor in on the training process so you can make the process more proficient. So here's some more ways to optimize your present EHR system. Enter your data in the right format. Enter all patients' visit data in correct format to trigger clinical decision support alerts. Again, this is another tool that is used for the Medicaid promoted interoperability. So when the provider's in the chart, during the process of entering the data, you may see alerts. So it's just very important that you enter the proper data so you can prompt those alerts and analysis through the reports. Customized balanced reports, ability to customize EHR to meet most of your practice needs. So again, it's all about making sure you have the relevant information that will help you make a correct medical decision for the provider. Use messaging functionalities internally. Utilize messaging functionalities for internal communication and coordination of defined roles. For example, patient portals. Those are examples of functionalities that can be used internally. Using the patient portal, secure direct messaging, data access, prescription refill requests, and appointment scheduling. All these are ways to that you can implement within your EHR system to get your patients engaged. Analyze claims to reduce denials. Use this for your EHR authorization. Process to identify claims and backlog to reduce gaps and claims rejection. According to the Center for Disease Control and Prevention, $315.4 billion was spent in the United States alone in 2015 to treat patients with congestive heart failure and stroke, with a large portion attributed to hospitalization. The research team pointed out, our calculations show that improving patient-provider engagement by increasing the intensity of portal use by one standard deviation from the sample mean is associated with 9.58% in reduction of readmission of risk. Patients who are more engaged in their care are more likely to use the patient portal, meaning those patients are more likely to adhere to their care plans, medication, and other actions that are necessary to take care of themselves and stay well. In an early study, we found that when a physician uses an electronic health record, their patients have better control of their diabetes and have their care managed so that they don't end up in the emergency room as often. And we are now finding that patients can use technology to better their own care, their medications, and their diabetes. So in talking about different templates and different ways to utilize your EHR, here's a snippet of a template of a patient. This is an example of a patient that was seen, well, eClinical, of course, is the EHR vendor, and here's an example of a customized template for practicing that uses EHR vendor eClinical. It is a customized to capture data regarding the patient's blood pressure. As you can see, the questions asked are relevant to identifying and managing patients with hypertension. One benefit of using this template within the EHR is that they have helped create consistency regarding patients' notes. And they also serve to remind physicians about the type of information they need to capture during this visit. So it asks questions like, did the patient take their blood pressure? Did they take it as prescribed? And this gives, if the patient doesn't answer this right, then it lets the provider know if there needs to be any changes made to this patient's care. Here's another report that was also pulled in a eClinical EHR system. This is a chronic care report. As you can see, this patient with multiple choices conditions are patients with multiple chronic conditions at an increased risk for poor quality of life. So the overarching goal of chronic care management is to help patients achieve a better quality of life through continuous care and management of their conditions. This is an example of how one practice with several locations delegated their staff to maintain their chronic care reports. They would periodically make sure that they were updated and will pull demographic information by location, provider, or by condition. Check with your specific EHR vendor to see if these reports can be enabled and walk you through how to make it work for you. Of course, the data that shows up in your report has to be discrete and captured in a template. Generating these reports can help with creating chronic care management, care plans, improve health outcomes. So there's a lot of ways to generate reports and pull the relevant information you need. If you reach out to your EHR vendor, I'm sure they can walk you through the process. So here's another example I want to show you on optimizing how you use your EHR. It can be real beneficial for your patients. It helps practices who are eligible to participate in CMS incentive programs. These programs require using clinical quality measures. So example, you see this is a nephrologist practice. Having a complete medical record is the first step, and being able to share the patient's information with their other providers is vital to coordinating care. This provider has alerts in their system to identify the patient's blood pressure if it's elevated, and controlled their chronic kidney disease. If the levels are elevated, a clinical alert will show up on the side, and this is how that particular provider captures this information. Okay, so now that we've talked about better ways to utilize your EHR, we're going to go into talking about some of the resources that are out there for coordinating care. So we know now during this COVID-19 crisis, telehealth is very popular at the moment. So we often, of course, get confused. What is the difference from telehealth and telemedicine? So I'm just going to kind of talk on that for a moment. So what is telemedicine? Telemedicine is the practice of medicine using technology to deliver care at a distance. A physician in one location uses telecommunication and to deliver care to patients at a distant site. All telemedicine is telehealth, but not all telehealth is telemedicine. So you see in the telehealth broad ranges of technology. They provide training, administrative meetings, continued medical education, public health surveillance, health promotion, and public health functions. So what is telehealth? Telehealth refers broadly to the electronic and telecommunications technology and services used to provide care and services at a distance. Telehealth is different from telemedicine in that it refers to a broader scope of remote healthcare services than telemedicine. Telemedicine refers specifically to remote clinical services, while telehealth can refer to remote non-clinical services. And I'll go into detail on a few slides down to kind of go over the billing and the different requirements for telehealth and telemedicine. And so on the side, if you can see right here, telemedicine, it says a subset of telehealth, and it talks about use frequently for follow-up visits, management of chronic conditions, medication management, and specialized consultations. And whether we want to admit it or not, this is the new norm, as they say, and things may never go back to the way they were. So the next slide will break down the difference in telehealth and versus telemedicine. So here's something I pulled off the AAPC website, some telemedicine billing and coding lessons learned. So this template talks about telehealth visits. You see that the provider uses real-time audio and video. Most are using DoxyMe or Zoom platforms to do these telehealth visits. And then you can see with the telehealth visits, these are some of the codes, 99201 to 99205 that are being used. And it says that the communication is video or audio for the provider only. And it also has the different modifiers that are being used to build this telehealth visits. And so and this presentation will be available to you after the webinar, so you can kind of see the different links and the different details within the medicine billing and coding lessons learned. So the next one is virtual check-in. So communicate with patients about the issue, but doesn't require E&M, does not result from a service within the past 7 days or result in a service in the next 24 hours or next available appointment. So those codes are usually G codes that are used for the virtual check-ins, and this is telephone allowed, provider only. So this is when the provider speaks with the patient via telephone, video, SMS, or email. And there's no modifiers used, and of course you have to use the place of service 11 for these codes. And then it talks about the consents that are required, the documentation. Patients are given verbal consent notes to subject to copay and deductibles. So the patient has to be given a consent in order. That's one of the requirements. The other one is e-visits, which is online digital E&M. And so we see those codes are 99421 through 99423. And this is patients initiated via HIPAA platforms, patient portals, secure messaging, other digital applications to communicate with the provider. And this is also a place of service 11. And of course, the consent must be done on those patients as well. And the last one is telephone only E&M, and those codes are 99441 through 99443. And the communication, of course, is telephone, and 11 place of service is 11. And so 90% of you are already billing telehealth, but the important thing is that you stay organized to ensure all are keeping track of all the different payers and the constant changes that are going on through the different carriers, I'm sorry. And you can see right here at the bottom, I have, it has Medicare, place of service, and it has TRICARE, United Healthcare, Blue Cross Blue Shield, Cigna, Aetna, and Humana. And again, like I say, we have some good links and resources at the end of this presentation that will take you to these websites, and you can look up what requirements are needed for each payer. So we'll go into some of the documentation requirements. Needed for telehealth services are the same. Of course, they're the same as face-to-face. If the patient comes into your office, the documentation is the same. So a statement that service was provided, that the provider was using telemedicine, the location of the patient, the location of the provider, and the names of all persons participating in the telemedicine services and their role in the encounter. And some of the other additional tips, of course, they have to be time stamped for the duration of the visit, the verbal consent, as I mentioned on the previous slide, verbal consent acknowledgement by the patient, and the complete record must be completed within 48 hours of the visit. So documentation, you know, they always say documentation is very important. If you don't document it, it didn't happen. So everything that you're doing pertaining to that patient, just make sure it's documented. So I just thought this was cute. I found this. It says, when I eat too much dessert, I don't post about it on Facebook, because if it isn't charted, it didn't happen. So just make sure you document. So we'll move on to talk about remote patient monitoring and some of the services and benefits that it has. So remote patient monitoring, as you can see, these are payments based on Medicare payer and copay. And remote monitoring helps increase the work capacity of physicians so they can provide treatment to more people at a time. As more healthcare providers open their businesses to emerging RPM technology, patients across the nation will gain better access to healthcare right from their own homes. And so this is just kind of talking about the different codes that are used for remote patient monitoring. The 99453, and it tells you the reimbursement is $21 for that code. And it goes on just to kind of give you the different reimbursement prices for the patient remote monitoring. And if you're interested, we do have one of our partners that we work with, which is SensorMed. If you're interested, we can send a link for you to make an appointment with them and for a consultation. And I can have that link sent to you. It was embedded in this presentation, but it's not here. So we can send that link to you if you are interested. And this is just kind of like a reimbursement assumption of what you will be reimbursed for using those services. Okay, so now we're going to talk about ways to bring revenue back into your practice. And we know we have the QPP MIPS and Medicaid Promoting Interoperability Incentive Programs. And we have, well, myself, I'm the program manager, of course, for the Medicaid Promoting Interoperability Program. And we work with providers across the state of Georgia to meet the requirements and assist them with getting through some of the challenges of meeting these objectives and measures. So we know the baseline requirements are you have to meet a minimum of 30% Medicaid patient volume in order to qualify for the incentive money. If you're a pediatrician, you can meet 20, the requirement is 20% of Medicaid patient volumes. And it's practiced predominantly in a federal qualified health center or rural health center and have a minimum of 30% patient volume. Participants must have adopted, implemented, or upgraded the certified EHR during the year one of their program. And we know this would have had to be done by 2016. So if you have not enrolled in the program by 2016, then of course it's too late. There's 2 more years left on the programs, and there's a lot of providers. We did an analysis, and there are a lot of providers that have participated in the program. They did the initial adopted, implemented, and upgraded their EHR system, but they didn't go back and attest to the other years that are in the program because of any they may be intimidated, challenges. But that's what we're here for, to assist you with getting through these programs. It's money that you're leaving on the table, and like I mentioned, there's 2 years left in the program. So if you're interested and you've already entered into the program, please reach out to us here at Hybrid Solutions to help you bring that money back into your practice for the next 2 years. The program ends in 2021, and next year we will be doing programs 2020 and 2021 within the same program year. And so this next slide just talks about some of the stage 3 requirements. Of course, security risk analysis. I'm not going to go through all of these measures, and but it just gives the thresholds and what you have to meet in order to be able to attest to these objectives and measures. And so we see coordination of care is a big thing. Health information exchange. You can see this is highlighted because these are some of the challenges that some of the patients or some of the providers are facing with getting their patients to do or being able to send information bi-directional with other providers. So it's a challenge. If you reach out to us, we have resources to help you get through this and to help you meet these requirements. So with that being said, like I said, a lot of providers are already in the program. Reach out to us and we can assist you get through this. And I kind of wanted to, I had a story I wanted to share to kind of piggyback off on that. Like I mentioned with the COVID-19 crisis, and I know a lot of small practices are facing, financial burden and during this time. And we had one practice that attested to stage 3 this year, and the provider and the practice manager reached out to us, and expressed how grateful they was that we were able to assist them to get through this, successfully submit their application, payment approved, and receive payment for this, because during this time it's a struggle, and they were facing financial problems through the COVID-19. So it was very rewarding to me that we were able to help her get through this process and to receive the money. And I think this was their last year. So they've attested to all 6 years of the program and successfully met all the requirements. So again, reach out to us. We can assist you with this. So I'm going to turn this over to Phoebe Nams. She is our program manager for the MIPS quality payment program. And she's going to go into talking about health information exchange and how coordinating care is important in that program. And she'll talk about some of the requirements for the QPP program.
Thanks, Selena.
Thank you.
That was a lot of information you shared, and I'm sure that they'll find a lot of value in it. And you know, not only are we going to talk about why data exchange is so important, but the crucial role that primary care providers play in the coordination. I kind of think of it as primary care is kind of like the quarterback for the patient. You know, they call the plays, and they have to pass the ball effectively and hope it's received. And so really it's about using the information across the continuum of care for the patient so that they have the best outcomes possible. We know it's challenging. We know that. But it's well worth the effort. Nothing worthwhile seems to just come to us easily. We have to make some effort to make it happen. So why is sharing information so very important? Well, it really does help improve healthcare quality and patient outcomes. Simple things like reducing medication errors or duplications of tests. It improves efficiency of care by, you know, really involving everyone that's on that patient's care team so that they have access to the same information. It also reduces administrative costs for the practice because it makes many administrative tasks simpler and more efficient when there is a clearly defined process and each person is assigned a role to coordinate that care and exchange information in the most seamless way. It's also another way to involve patients in their own care and reduce the amount of time that patients spend filling out information repeatedly, sometimes the same information. And it gives providers the opportunity to share care plans. And that also leads to patient satisfaction being improved. So another impact that can really be highlighted by the current public health situation we find ourselves in is that being able to share data seamlessly helps coordinate with and support public health officials to improve the health of the overall community. It allows doctors, nurses, pharmacists, and other healthcare providers and patients to access and securely share the patient's vital medical information electronically, improving the speed, the quality, the safety, and the coordination, and as we mentioned, reducing overall cost of providing healthcare. So what are some of the things that we provide that help with data exchange? As we look at our next slide, we'll see how Hybrid Solutions has a platform that helps connect various places of service so that patient health information can be shared across. So we act as our name cleverly shows, HighBridge, as a bridge between these different places of service and connects them directly to our state's health information exchange, GHIN. So smaller practices in some of these places may not be able to connect directly to GHIN, and so through us, there can be that facilitation of connection so that we can share information between several types of healthcare organizations and connect the practice to the patient's information that supports coordination of care. And it should do this without regard to the specific EHR system that is used. So that's why it's an effective bridge. So as we look at our next slide, regarding the quality payment program, specifically MIPS, merit-based incentive payment system that is applied to that many small practices in Georgia are eligible or required to participate in. Of the 4 categories, quality, promoting interoperability, cost, and improvement activities, one of them we'll talk about briefly, really focuses on how we can coordinate care. It's improvement activity, PM_13. Next slide. chronic care and preventive care management for empaneled patients. So this requires that, first of all, you identify the patients who have a specific or a combination of chronic conditions, and create an individualized care plan for those chronic conditions using evidence-based, condition-specific pathways for care. And so you would use pre-visit planning to optimize the preventive care and incorporating the whole team in managing this chronic or these chronic conditions. So before the visit, a review of the patient's record would be conducted to identify any gaps in care and to see, well, what can we do to maximize everything that happens on their next visit. So you would use maybe the registry function that exists in your EHR to identify those services that are due. So all the patients with a specific condition, you can add them to a registry within your system so that when you run a report to look for those patients and you identify them by means of your codes, then you can get a snapshot of all the patients that might need or benefit from the planning, pre-visit planning, and other support services. So it also helps you to be specific in reaching out to those patients with reminders of services that are due, and also to be able to conduct updates on what medications are they on currently. How can we reconcile what they may be taking across various prescribers. Next slide. So this improvement activity, because it is a part of a CMS program, we know that everything that is reported to the government through these programs for the incentive payment, this year it will be up to, according to legislation, a positive 9%. Although because of the number of participants, the positive reimbursement may not be quite to that level, but definitely the penalty is 9%. So we want everyone who's required to participate to do so. And if you participate, then please, please, please document. As Selena's cute illustration in the previous slide shows, if it isn't documented, it didn't happen, or you need to be able to prove that it happened. So keep your documentation of this processes that you put in place to provide this care management for empaneled patients for at least 6 years. We have here an example of a worksheet or a template that can serve as part of your documentation process. It helps you plan, well, what are our policies? You could stick that in. What are we trying to achieve here? What's the goal? And then how are we going to achieve that goal? Plan, then execute it and document how you did it, and maybe have a few sample patients that you can refer to, and then keep this document on file as part of your documentation. You can also use meeting notes, your meeting agendas, EHR reports as evidence of the individualized plan of care that you create for each patient. Appointment schedules and team meetings, the notes from team meetings where you've done this pre-visit planning for these specific patients, and condition-specific protocols that you have in place to make sure that all the boxes are checked that are required to manage this particular condition. All the tests are administered, and how you're going to incorporate the results, and things like that. In order to, next slide, receive credit for this activity, the MIPS eligible clinician has to manage chronic and preventative care functions for the empaneled patients. That is, patients assigned to care teams for the purpose of population health management, which could include one or more of the following actions: providing the patients annually with an opportunity to develop and or adjust their individual plan of care as appropriate to their age and their current health status. So that could include things like the health risk assessment, considering their gender, that impacts preventive services, their age, and the conditions that they specifically have that might require management. So it also requires that clinicians use evidence-based, condition-specific pathways for care of chronic conditions. For example, many of the top chronic conditions are hypertension, diabetes, depression, asthma, heart failure. And so these might include, but are not limited to, the national NCQA recognized training programs and resources that are available from the Heart Stroke Recognition Program or other CDC resources that are available. And at the end of this presentation, we have a long list of resources that are helpful in doing this. So using the pre-visit planning, those preparations for conversations or actions that you want to discuss with the patient before that in-office visit to help maximize or optimize the care team's opportunities to educate and also be proactive in the management. And we already talked about, using the registry that you can compile in your EHR or some other technology tool that you may already have in use to identify trends or data points in the patient's file that really show what action needs to be taken on their behalf. Some EHRs actually have predictive analytic models to predict risk and to track the onset and progression of diseases, and those are helpful tools as well. And as we mentioned, we want to use the information that we have on each patient to support our outreach, targeted outreach, which could be a phone call or email or postcard or sending a message through the patient portal. So we want to be alert and keen to these opportunities to educate patients about the services that are due and also to complete routine medical reconciliation. So this improvement activity is just one of over 100 that are available to clinicians who participate in the Quality Payment Program MedStrack. And so it can serve multiple purposes in that not only do you participate in the incentive program, but you can also utilize the reimbursement opportunities that are presented by using the annual wellness visit and also the care coordination reimbursements that are available, CCM reimbursements that are available to those who provide care for Medicare patients. So we also have resources that we can share after the presentation on that as well. So this month, we have started something new. We want to make all our attendees aware of the resources that or partners that we collaborate with to provide more opportunities for this care coordination. So we have our bridge to the Georgia Health Information Network, Hybrid Solutions Connect. And we also partner with the Georgia Department of Community Health, promoting interoperability program, and also in partnership with Alliant Health Solutions. They they oversee our work in providing the Quality Payment Program, QPP SIRS, Small Underserved Rural Support for all small practices in Georgia. 15 or fewer clinicians in a practice qualifies for that grant-funded support. And in addition, Selena mentioned SensorMed. So many people wonder, well, how can I accomplish this remote monitoring of my patients with chronic conditions? This is an excellent platform that has been developed and can increase the reimbursement rate, but also by taking advantage of the telemedicine reimbursements, but also they provide the equipment that is needed to perform these monitoring services. And then iPrescribe is an excellent platform for that mobile prescription process that can really help clinicians stay connected with the database, the state database, that they have to check before prescribing controlled substances and opioids and things like that. Premedics is a wonderful company that does a lot around care coordination, chronic care management of patients remotely. They have on staff people who will call and follow up and help you manage this. And that's another way to maximize your reimbursements, by covering all the bases. They're experts in the billing, the coding, the requirements, and provide support to practices that want to work with them. So it's worth giving them a call to see if it's a good match for you. 4Med provides education, and that is our featured partner for this month. So one thing I really appreciated about them is that during the onset of the COVID pandemic, they made available certification that any practice, and they made it available free, that any practice could access to be up to par in the sanitization and following all those guidelines that CDC put forth. And you could actually acquire a certificate in that. There are also tons of other continuing education courses here on HIPAA and security and, front office management, and even on the quality payment program. Every year they update their offering so that practices can become experts in the requirements for QPP, a one-stop shop for so many educational needs. So at this time, we would like to see if you have any questions that we could answer. I know we received some during the registration process, and we want to thank you so very much for submitting those questions to us. And so maybe we'll, between Selena and I, we'll try to tackle some of them. I see one in the question box. Do you suggest Z-codes to track social determinants? Well, based on what I've read, this is being underutilized. Selena, did you want to take on this one, or you want me to? I guess I'll continue.
I'm sorry. I got it.
Okay.
I'm sorry, I was on mute. Okay, yes, feedback could take over this one. Yeah, I know one of the questions, well, this someone asked, do you suggest Z-codes to track social determinants? And someone also asked, to what extent are Z-codes being utilized as a way for providers to meet the multiple needs of their patients? I will answer yes to the social determinant. And as far as Z-codes, yes, they are underutilized. However, they're usually used when some circumstances or problems are presented, which influences a person's health status, but is not itself a current illness or injury. So for example, a lot of these codes are used for psychiatric examination and observation of suspected mental and behavioral disorders. And according to some of the research, they are, like I mentioned, they are underutilized. And in 2017, only 1.4% of claims were submitted with these codes. And as we know, they replaced the V codes that was used when we were using ICD-9. Doing ICD-10, the Z codes are replacing the V codes. And they are 3 to 6 characters long. So usually they're used, and they can be billed also under first listed codes in specific situations like aftercare and administrative examinations, or they can also be used as secondary codes. And if you want some more information on that, you can put your information in the chat box and I can send you some more information.
Thank you, Ms. Williams. We have another question in the question and answer pod, and it says, please clarify what the SensorMed platform is used for. So can it be used for performing, AWVs, CCMs, or something else?
So the SensorMed platform enables the remote monitoring of patients and the incorporation of the information into the electronic health record, so that it provides opportunities for the clinician to have more of a pulse on what's going on with the patient, rather than just in between patient visits to the actual office. And of course, since that has been drastically limited by COVID, then it's really become another way that patients can have their health monitored and adjustments made. Let's say they have a 5-pound weight gain as reported by their scale. And then that might indicate that, they have some fluid retention going on, and the provider can reach out to, do an assessment and maybe tweak something to keep them out of the hospital, or to identify areas where they may be in distress quickly. So it's a very useful platform for collecting patient data in real time, and having that being responded to by the clinician, thereby managing their condition more effectively. And you can always reach out to them for additional information and more detailed and specific responses to your inquiries. They'd be glad to hear from you.
Thank you, Ms. Nelms. And we will now move on to our next question. And again, we encourage you, please submit your questions into the question and answer pod. And the next question is, how can one create an easy to understand care plan for patients with multiple chronic conditions?
Well, it can be challenging to capture the information for all, but maybe you could combine them side by side in a document. There are lots of great guidelines that on how to. It's not like a one size fits all. So it would be great to look at CMS and CDC resources that outline the basic requirements, and then create a template that works for you. So some of the basic requirements would be that you have a complete problem list. You might be able to pull some of this information definitely from your EHR to guide how it's set up and how you want to merge the two sets of information, or use one to populate the other. So a complete problem list. What goals do you want to set in collaboration with the patient to define expected outcomes and improvement in their prognosis? Measurable treatment goals, symptom management, planned interventions, and identification of their response for each intervention. How will you do medication management? And also a list of community or social services that you've recommended or ordered. And a description of how these services or agencies and specialists outside of the practice, how you will coordinate with those agencies or other specialty practices. And also a plan for scheduling the periodic review and revision of the care plan. So we can send anyone who is wanting that several resources on provided guidance on how to create the care plan and what the key components are.
Thank you so much.
I found a really good one. On the American College of Physicians, they have a CCM toolkit, and in there is a good guide on what needs to be included in it.
Okay, thank you so much. Our next question, can either of you discuss how remote monitoring is being used, or practices that you may be familiar with who are using remote monitoring technology to improve the health outcomes of their chronic disease patients?
Well, yeah, I was speaking to someone the other day, and they were just so excited that their practice had sent out the equipment necessary to monitor weight, blood pressure, do glucose monitoring, and they were just really excited to connect all the equipment so that they could have that. It is being used, and it is a fantastic opportunity to avoid the escalation of certain symptoms that can lead to a hospitalization. So a lot of people are utilizing it in that way, and it's proving to be beneficial.
Thank you, Ms. Nelms. Okay, Ms. Williams, we have a question for you. Can you please elaborate on how telemedicine services are being used to treat patients with chronic conditions?
Okay, so as far as, well, we know most patients with chronic diseases and with the COVID-19, they're at high risk for not being able to go into the actual practice to see the physician. So them being able to do it by audio or by telephone, the provider can still provide the care to them that they need without them coming into the office. And they utilize this through telehealth and telemedicine.
And somebody asked too, how can they kind of alleviate their patients' fear about coming in? So we've heard some really resourceful and ingenious things that practices have done. One practice manager I spoke with, how she helps them alleviate their fears is that she outlines very specifically in detail through several methods of communication how they are putting in place their sanitation rules, their social or physical distancing rules. So she'll describe how, their sanitation process, how they do that, and then she has them wait in the car. The patient calls the practice when they arrive, and they have a window that they come in, and they're screened, and then they go back out, sit in their car, and wait to be called in for their appointment. So that's how they maintain the physical distancing. Another practice, they have a corner office with a window on ground level. And what they've done is basically use that ground floor corner window as a drive-through, window for patient care. They screen them, take temperature, and then they provide care that way. So practices have been extraordinarily resourceful in how they've met the challenges of the pandemic, but a lot of it is putting processes in place, informing and reassuring the patients, and then executing it consistently. And that gives them a better feeling of security and peace of mind that their safety is top of mind and top priority.
Thank you so much for a very comprehensive answer. So we have another question, and this question is again in the space of remote patient monitoring. And the question is, who instructs the patients, from your experience, who instructs the patient on how to use the remote patient monitoring equipment? Is it the clinician's responsibility? Does the product manufacturer or the provider of the RPM provide this type of instruction?
That's a great question. And I will have to do some research to find out the most accurate answer. I think it would probably depend on the platform and also what, I think I need to do some research to find out precisely how, based on the vendor or the circumstance under which the equipment is performed. Because some practices, they say, okay, we want to do this for this many patients, and they will use a service like SensorMed to accomplish that. And others may use different methods. So we're not quite sure. It depends on what solution they're employing. Of course, we know that clinicians are exquisite educators, and that that's a large part of their function as providers, is providing the knowledge base and the education for their patients to be successful. But we also know in reality that many times it is family members and other caregivers that really assist the patient in setting up this equipment. It's designed to be very simple and user-friendly. It should not involve a tremendous amount of technological prowess on the part of the patient. So it's an opportunity for us to investigate and learn more about that subject to answer your question, Melissa.
Oh, thank you. Well, unfortunately, we are coming close to the end of our time for today's webinar. If you have any burning questions that were not able to be answered today, you can email Ms. Nelms, you can email Ms. Williams, and you can also email Hybrid Solutions Support. The email address and contact information for these three wonderful sources are presented on this slide. And once again, this recording will be made available to you within 48 hours following today's webinar. Additionally, we invite you to continue the series. On June 30th, we will host another webinar focused on clinicians coping with the impact of COVID-19. Be on the lookout for that email invitation. These resources will be made available to you via email, and these are many of the resources and more that were discussed during today's presentation. On behalf of Hybrid Solutions, the Morehouse School of Medicine, we thank you for your attendance in today's webinar, and we hope that you have a wonderful afternoon.